Hi, my name's Andrew Tatham. I'm a glaucoma consultant at the Princess Alexandra Eye Pavilion in Edinburgh. MIGS is a really hot topic at ESCRS this year, just because of how important it is for changing the management of glaucoma. MIGS offers a really safe option for earlier surgical intervention in the glaucoma patient. There are patients with cataracts and glaucoma where cataract surgery can be combined with MIGS to help reduce medication burden, but it can also be performed standalone as well. Adherence is one of the biggest problems for glaucoma patients, so early surgical intervention can help overcome that barrier to effective glaucoma care. I think the Omni surgical system provides a really good option for patients because it tackles 3 sites of outflow resistance. It can help overcome the resistance in the trabecular meshwork, but also resistance within Schlemm's canal, and then more distal to that in the collector channels as well. So it can give powerful pressure reduction. And that's what I've been seeing in my practice in the just over 2 years since I started using it. And I've been able to use it standalone or combined with cataract surgery. It also has 2 different procedures in one device, so you can tailor the treatment to the individual patient. I think the ideal patient for an Omni procedure would be a patient that is also undergoing cataract surgery, who's maybe on multiple medications and wants to reduce that medication burden. But equally, I think even a patient on one medication, if they have a cataract operation combined with an Omni, they have a very good chance that they could be completely medication free. So I think that's a really good indication. But also one of the good things about Omni is that it doesn't involve an implant, it's implant free. And you can also confidently perform it as a standalone procedure as well. Omni is unique, I think, in the MIGS landscape because, well, first, it's an implant-free procedure, but second, it makes sense to me to try to rejuvenate the outflow pathway. Now, the primary pathology in glaucoma is not optic neuropathy, it's a disease of the trabecular meshwork, a disease of the outflow pathway. That's why patients develop high pressure. And trying to unblock the outflow pathway makes complete sense. So it makes sense as an initial surgical treatment option. And then perhaps, if that doesn't work, you always have the option later on down the road to consider a procedure with an implant perhaps. And so it makes sense, when we look at a stepwise approach to glaucoma treatment, it makes sense to have that as one of our initial surgical steps. Well, something I'm really excited to be presenting at ESCRS is the results of a study using the IRIS registry. The IRIS registry has been developed by the American Academy of Ophthalmology, and it's the largest real-world registry looking at eye conditions. So in this particular study, we looked at patients that have been having cataract surgery alone, or cataract surgery combined with Omni, or with Hydrus, or with iStent. So those 3 MIGS procedures. And all patients having these procedures over 4 years were included. And it's a huge number of patients. There's over 100,000 eyes and 77,000 patients within the study. And the results were really supportive of MIGS technology in general, because it showed that patients who had phaco MIGS compared to phaco alone had lower pressures and were on fewer medications. And when we looked at the differences between the different MIGS procedures, it was those patients that had phaco Omni who had slightly lower medication burden than the other MIGS procedures. So I think it's really exciting to have this good quality, very large real-world data. As we adopt different new technologies, it's really important that we have real-world data to support their use. And it's important to audit our own personal results, but there's power in combining results across different centres, across different countries. And using electronic medical records, it really facilitates that high quality, large scale data. That's particularly useful as well for trying to pick up rare complications that might not manifest in small randomized control trials. So it provides really good evidence about the safety of MIGS procedures as well.